Hello, and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton. I am excited to have our guest today to talk about something that really doesn't get enough attention. And I would say this is a looming healthcare crisis, but this is something we've been dealing with in America for a long time. And COVID really shined a bright light on the mental health crisis, but the issues concerning how we deal with mental health in this country have gone under the radar for years. So today we're going to be talking about the mental health crisis here in America. And I have a great guest today, Matthew Stanford, who is well knowledgeable when it comes to mental health. So today I'll be talking with Matt about mental health, this mental health crisis, and some innovative solutions in addressing these problems. But let me back up and just tell you a little bit more about how I met Matt. It's okay if I call you Matt, right?
Absolutely.
Okay. Matt actually spoke with us at an Executive Association of Houston breakfast. I'm a member of this organization. And what really struck me was his depth of knowledge in dealing with this industry and some of his practical approaches when it comes to talking about the healthcare crisis and how we're dealing or not dealing with it adequately here in our country. He's well educated on this matter, as you'll see. I look forward to hearing his insight, and I'm sure that you'll come away after listening to this podcast with a better understanding of how we got to this point in our nation with dealing with mental health and hopefully some positive steps that we can take moving forward. But first, let me tell you a little bit more about Matt Stanford. He's an executive officer, author, and a scientist with a history of working with individuals and families on mental health and mental health services. He's skilled in nonprofit organizations, public speaking, writing, and fundraiser, and is a doctor of philosophy focused on behavior neurosciences. And he taught for many years at Baylor University in Waco on this. He's also the host of a podcast, Madness and Grace. So I would recommend everyone subscribe and listen to that podcast as well. He's the current CEO of the Hope and Healing Center and Institute, which we'll hear more about today, and also adjunct professor of psychiatry with Houston Methodist and the Baylor College of Medicine. So welcome to the show, Matt. I'm excited to talk with you today and to dive into this whole issue of mental health. So let's open up very broad, and I want to get your perspective on what we're dealing with when we talk about the mental health crisis. Some recent reports show the economic impact of mental health in the U.S. at around $282 billion that we're spending on mental health. This is about 2% of spending. 1 in 5 Americans have a mental health illness. You deal with this every day. How big is this problem in your eyes?
Well, it's a disaster. I mean, it is a literal disaster that, in some sense, it's at a pandemic kind of level. Like we talk about with COVID, so many people are struggling with mental health problems, and what most people don't understand, I think, is the majority of people with mental health problems never receive any treatment. So it's not just that those people themselves are affected; it affects their families, it affects their family's livelihood, their ability to function as a family. There's a lot of suffering that's going on. It leads to divorce and problems with raising children and economic issues, and it undermines and undercuts every aspect of our society. I mean, if you look at the criminal justice system, for instance, 64% of jail inmates have a mental health problem, and that's not including substance use. If you look at the state systems, over 50% of the inmates in state prison have a mental health problems. Look at the federal system, 54% have a mental health problem. Look at the homeless. For the longest time, we had this statistic that 30% of the homeless had a serious mental health problem. But the data over the last few years that are coming out of California, which is a much better been a much better approach. It's suggesting that as much as 75% of the homeless are struggling with mental health problems. So, we have 10 times more people with mental health problems in jails than we do in hospitals. So it is a true disaster. And that's, again, there's no other medical condition like this where a majority of people don't receive any care. And for some reason, we don't really ever talk about this, I guess because of the stigma and shame that's associated with it.
And I mentioned a couple of times on this show and other episodes about the differences between preventative versus catastrophic care. And unlike other conditions, like if I were to break my arm or in a car, you'll physically see that. You can see that I've gotten a broken arm or if I'm bleeding and so forth. But when it comes to mental health, most of the time, as you just mentioned, you don't know necessarily that someone has a mental illness. And because of these nuances with getting treatment, a lot of times they don't present until it's catastrophic, until it's really bad. They've had some type of psychological breakthrough. So can you just talk a little bit more about that? Like, where do people go? Where do they end up when they need this severe mental health treatment or care?
Well, I think most people are pretty naive when it comes to their mental health, just in general. They think about physical health a lot. We talk about that all the time. When you're a child in school, you do the president's fitness test and you have health class, and they talk about your body and different kind of things like that. They may even talk about things like diabetes or stuff like that. But it's never any discussion of mental health. And so people just generally very naive. So they don't really know what to look for or how to recognize a mental health problem unless it is an absolute aberration, like a psychotic episode or something like that, where someone thinks they're Jesus or have superpowers or something like that. But what we find in the U.S., what research has shown is that people are more likely to engage a clergy before they engage a mental health care provider or a physician when they're struggling with these mental health problems. Now, they may not recognize that they have a mental health problem. Yeah. They may just know they have a problem. They're losing jobs. They've lost a relationship, whatever that may be. But they end up with a clergy. And what's really interesting about that statistic, which I find particularly interesting, is it's not just people that are associated with faith communities or believe in God. It's anyone in the general population. They just know that there's somebody there that's supposed to care for them, that's educated, that'll talk to them, and they go there. But just a lot of clergy don't make referrals because they don't recognize, because they're naive too. They don't recognize what's in front of them. Nobody walks in and says, "Hey, I woke up this morning, I think I have bipolar disorder." They don't, they walk in and they say, "I'm not getting along with my wife," or all I ever do is sleep, and I'm not, I lost another job. So they don't really recognize it necessarily as a mental health problem. But the majority of people that engage the mental health care system itself engage it in crisis. Yeah. And that's probably a combination of things. It's a combination of not understanding what's going on in them, and they just kind of wait. And the wait times to get in to see a mental health care provider are unbelievable. It can be weeks at best sometimes months. And so, imagine, in the U.S. right now, and that's for people lucky enough to get care. In the U.S., as I said the other day when we met, the average period of time that passes from the onset of symptoms, which typically happens between 14 and 24 years old, and first treatment for people lucky enough to get treatment is 11 years. That's the government's data. They get that data every year. It is an unbelievable period of time. There's nothing else like that. And and part of the problem here is there's a lot of stigma and shame associated with mental health problems. If you were to say to, just your buddy, "Hey, you were telling me this problem you have, maybe you should go see a counselor or talk to a therapist." People take that as an insult. If you were to say, "Hey, you really should go get that, you told me for 3 days your belly hurts. You ought to go have somebody take a look at it." They go, "Oh, that's a good idea. I might do that." You tell them like, "Hey, you tell me that the deal you're having, you're kind of concerned about those thoughts that you're having, or you're really feeling down. Maybe you should go talk to a therapist." That's an insult. Yeah. You're saying they're weak or something. And so that keeps people from getting care as well. And plus, then you just can add in whole layers of different cultural perspectives. I mean, if you the ethnic group in the U.S. that accesses care the least are Asian Americans. Only 17% of Asian Americans with a diagnosed mental health condition will ever receive any treatment because there's so much shame in that community in the context of mental health. It works out into the family and everything. So they actually will try to keep their loved one from going to care because they see that as a shameful act to go and tell people about those problems. And it varies from culture to culture. So there's a lot of things going on. But really, at the heart of it is just a real naive understanding of mental health problems, that they're real problems with real solutions, and that's the saddest part. And we really need to get that into the narrative of our society.
Yeah, you're so right, and I think as a house of medicine, as physicians, sometimes we fail the system as well, because you have to be intentional and have the time and talk to patients. And there's been so many patients that have come in for other things that, like headaches, for instance. And if I don't sit there and take the time to really find out, well, how are you doing? You find out that the headaches are just a manifestation that they have some underlying depression.
Right.
And if you really talk with them and dig a little bit deeper and you treat things like the depression or the underlying mental health, all of a sudden now the headaches are better. So there is an intentionality that you have to be, as opposed to those things, like you said, the visible, if you're bleeding out or something like that, where you can see that, you got to dig a little deeper to find these mental health issues.
And again, part of the problem there is the way our medical system is, in essence, funded. And since it's so insurance driven, long ago we, probably in the 80s or so, we handed over the mental health care system to insurance companies to basically tell us how are we going to provide care and because of what they'll pay for. And so, I know lots and lots of providers that, they have to stack the clients in, the regardless of what type of physician you are or a therapist you are, you have to stack the clients in one right after another to be able to maintain a practice. And you only have a limited amount of time. And you're absolutely right. I mean, somebody comes in, you're a neurologist. I could think of 50 different kind of things somebody could come in and try to convince you that it's a neurological problem when in reality it's just a manifestation of a psychiatric illness. And, you have the luxury of being board certified both in psychiatry and neurology. Most neurologists aren't. And so somebody comes in with a neck pain or even arm pain, back issues. I remember when I was doing my postdoctoral work at the medical school in Galveston, we did all the assessments for chronic pain clinic, and for all the back pains would come in and we would do assessments on them. Plenty of them had not only sometimes was their pain a manifestation of an illness, their pain had caused a psychiatric illness, horrible depression or anxiety, and those things were going completely untreated. Medicine has become, again, so specialized, partly because of the things we've found within medicine, but also in the context of the way it's funded, that, you go into a doctor and depending on what system they're looking at, they don't ever even think to ask you about these other things. And so, if you look at the data on how many contacts a suicide victim has with their primary care physician in the year prior, even in the month prior to their actual suicide, it's disturbing how many times they go in. And they usually go in for physical issues. Yeah. But it's really a representation of their depression. And we just don't train physicians to be able to assess them effectively because we don't give them the time to do it. It's not an issue that your primary care physician couldn't do it. They absolutely could do it. But they need to spend about 45 minutes with you every time. And you could speak to a much better of what would be like to have a practice where every single client you spend 45 minutes to an hour with. Yeah. You're only going to see a limited number of, and then is the insurance company, well, why are you spending so much time with these people? So that was a follow-up appointment. So, we've got a lot of problems that kind of work on top of one another. But, the issue is that, majority of people with cancer in the U.S. are getting treated. And when people recognize that they have cancer, they know where to go. And, there's a system for that. In the mental health care system, it's really just a disjointed set of resources. And as you mentioned earlier, the amount of money that we spend on mental health care every year, you would literally transform the United States economy if we would take care of the mental health crisis that we have. We would have so much more money to spend on social services and military and whatever your thing that you like to spend money on is. We'd have billions and billions and billions, pay down the debt. It would really be, and on top, in a less selfish way, there would be a lot less suffering.
Yeah, that's a good point. And the other thing, which we were talking about before we came on air, is that there's this socioeconomic disparity between the two, because unfortunately, a lot of the visits now are cash pay. Mm-hmm. So if you have the means, then you're able to get in to see a psychiatrist, versus if you don't, then you end up in the emergency room or back of a police car or something like that.
No, you really are. You sadly are seeing the care that's available within what we think of as the mental health care system right now is very quickly being moved to it's only for the wealthy. As I was telling you, if you have before we got on air, if you have money, I can get you an appointment this afternoon with a great psychiatrist. I can get you an appointment this weekend. Like I told you, I know a guy who does weekend appointments on Saturday and Sunday, but all of his patients, he takes a limited number of patients. They all pay direct pay to him out of pocket. And he provides, I literally know a guy here in town, great psychiatrist. If I were to give you the phone number to call him, it's his cell phone number. Like he talks to every client. He decides whether you're going to be his client. He takes you on, you're going to get incredible care, but it's all direct pay. Mm-hmm. But if I refer you to a psych clinic here in town or someone who just works off of insurance, which are very quickly disappearing, it could be weeks to months before you get in. And so you're right. Our emergency rooms have become our de facto mental health clinics. And also psychiatric beds are disappearing because psychiatric beds, they lose money for hospitals. A lot of large hospital systems have no psychiatric beds. An unbelievable statistic is that there are less than 100,000 psychiatric beds in the United States. It is hard to even imagine that 1 in 5 or 1 in 4 people with mental health problems in the U.S., a subset of those are going to need to be hospitalized, and there's less than 100,000 beds. That is just unbelievable. In the state of Texas, one of the largest states, one of the biggest populations, we only have about 3,000 indigent beds, that's state beds. That's for people that don't have the ability to pay or in the state system. So, we have 22 million people living in Texas. That's just... I know there are private beds, but that's not a lot of beds. And again, I'm not looking to get back into the asylum days where we have these giant warehouses. But when we shut those down in this, and this is kind of how we got here, in this idea of deinstitutionalization, which really they needed to be reformed. They didn't need to be shut down. We shut them down with this idea that we would set up these community clinics. The federal government was going to fund these community clinics, and so you would be treated in your community where you were, and you'd live at home. And there was a horrible underestimation of the numbers of people that would actually need to be hospitalized long term. And they never set up the community clinics. They never built them. And so we really didn't deinstitutionalize. We trans-institutionalized. We moved those people into jails and prisons and onto the street. And so, we just traded one problem for another, and really we just increased those individuals and their families' suffering.
And tell a story about the Children's Institution that you work for.
Yeah,
I heard that blew my mind.
Yeah, well, Texas has 11 or 12 or so state hospitals, and many of which are not even fully functional. A lot of the buildings have been condemned and they're not using them. But first, I have to say this, that Texas ranks 50th of the states in access to care. But I did my doctoral work at a place called the Waco Center for Youth, which is the state children and adolescent facility, and it's in Waco, Texas. And it was built in 1919, and they still use a lot of the original buildings. I mean, it's just a horrible place. I mean, it is a place where children and adolescents are just dumped, and when they don't have a family that can take care of them anymore, and they live there, and it's the people that work there are wonderful. I mean, they're doing the best they can, but to imagine that you would be using a facility that was, over 100 years old, that it really had never been significantly updated, that, it's nothing. It's not where, I have children, you have children.
Yeah.
If they had a psychiatric problem, I would want them to be in the best place possible. And,
Absolutely.
And I'm a proud Texan. I want to think that, the children of Texas, whether they have money or not, they should be cared for. And, so I look at that, and I told that story when we met before, because, I think if we can't recognize that we need to do the best we can for children, particularly suffering children, then what hope is there for us to have a system that, effectively treats adults?
Yeah.
And, that really, that should be a bipartisan issue.
Yeah.
Children, we should be spending so much money on children just generally. Everybody should line up for that. That shouldn't be something that we should argue about.
And I really worry. I worry about that a lot because with social media, and we have these fights at home all the time about cell phones and all of that. But what it's really doing a number on the kids when it comes to socialization, learning how to interact with each other, and I really worry about that because I don't think they're getting the right attention when it comes to mental health.
Right. No, not at all. And we already had a pretty significant decline in mental health, particularly among younger individuals, really starting around 2000. But once social media, came into play, they considered 2010 kind of the age of the dawn of the social media age. You really see dramatic increases, particularly in adolescent females, and depressive episodes and anxiety, and suicide rates are significantly changing. And really what it is everything we think it is. It's this impossible comparison. It's, they don't see themselves as having value. They can't live up to these standards. It's constant negative, bullying. You can't ever get away from it. And then also it is really undermining young individuals' ability to use what is our greatest coping skill, which is kind of supportive language and interaction. And so kids are waiting longer to get their driver's license. They're not dating as often. They don't hang out. They don't go out with friends as often. I mean, the data is just consistent that they are interacting with each other only through social media. They see themselves as more connected than any generation in history, but the reality is that they're less connected. Yeah. For you old folk out there like me, just imagine trying to have a emotionally, heavy conversation with somebody via text to where you feel like you can get supported with a problem you're having. I mean, I'm not saying it's not possible to kind of do that, but that's not the same as sitting down and seeing somebody and showing empathy, and they've lost that. And so social media is as bad as you hear, and probably worse. It is absolutely undermining our culture, and I'm not sure what the overall answer is. I think for parents, the answer is there's no way you can keep your children from using it, and there's no way that you can completely separate yourself, go off the grid and live out in the middle of Montana or something. I mean, what you need to do is you need to moderate it. You need to know what social media sites your kids are on. You need to have periods of time where they, like dinner time where you're all together and you're not on your phones. You need to have regular interactions with your children to see how they're doing, just generally. And I think that's another thing is we're so disconnected as families. We don't have those interactive times. So parents aren't really picking up on the fact that their kids are, from a mental health perspective, they're starting to decline. And you mentioned earlier, COVID kind of brought it all home. And it did, because we were forced all together.
Yeah.
And so parents actually had to spend time with their kids, and parents actually had to spend time at home with each other. And they were forced to interact, and they suddenly realized how much everyone was struggling.
Yeah.
And, COVID made things worse, but COVID also kind of showed us the problems we were already having.
It was so... COVID, it wasn't just the disease; it was everything else that came with it that really,
absolutely,
really shined a light on a couple of things, including mental health. I want to talk just a few minutes about treatment. Mm-hmm. And during your talk, you mentioned about the number of people who are on antidepressants. And historically, when we think about treatment for mental illness, there was always this debate about, is it more drugs or more counseling? I know that you, which we're going to hear about the Hope and Healing Institute, into the counseling aspect, but now we have surgical treatments and radio frequency and so forth. What's just your overall take on the treatment aspect when it comes to mental illness? Is it a more of a pharmacological thing, or is it a counseling, or is it a combination of all of the above?
Yeah, and I think the sad thing about everything we've talked about all these people not getting care, is that there are effective treatments. I mean, I'll be the first to line up and tell you they're fantastically effective treatments. I've run a clinic, and we see incredible results. And so, that's the big question always. It's a nature-nurture kind of thing, biology or environment. And really, it's both. Every illness has components of both. Some illnesses are clearly much more heavily biological. Someone has schizophrenia or bipolar disorder. Those individuals have really what would be best described as a brain disorder. In fact, what we see now with the data from particularly schizophrenia, but also bipolar disorder, more severe bipolar disorder, is it's neurodegenerative. Those that don't receive treatment, they can lose up to 5% of their brain mass every year. It's
true.
You're neurodegenerative, and so we're not talking about something you just think your way out of. And
Absolutely.
so they're definitely going to need medication, but certainly for schizophrenia, some psychosocial interventions to help them interact better with others and kind of recognize some of the odd thinking they're having. But then on the bipolar, there's some great therapeutic interventions, a talking therapy. Really, what research finds overall is when someone has a diagnosed mental health condition like depression or anxiety disorder, or any of these others, a combination of medication and therapy is most effective. Sometimes medication is most useful because it helps an individual get through therapy. They wouldn't be able to sit through therapy without. Medication is not a silver bullet. It minimizes symptoms. In almost no case does the psychiatric medication that we give somebody actually treat the actual problem, because we really don't know what the problem is.
Yeah.
It treats something it affects something that then minimizes symptoms, but that's not a bad thing. We do the same thing with. We don't exactly know what causes diabetes. If we did, we wouldn't have diabetes anymore, and so, but, diabetes is a chronic condition that can be very effectively managed. If we were directly altering the problem, then the diabetes would be cured. So, a lot of times mental health problems get this kind of bad name, like somehow we don't really, since we can't, quote unquote, cure them, then the treatments aren't effective. But we have lots of conditions, heart disease. A lot of chronic conditions that nobody ever thinks about that. You undoubtedly, you the listener out there, somebody that has diabetes, but you have no idea that they have diabetes. Yep. And so it's the same thing with these others. So, a combination of both. I think the problem, that when people do, the majority of people don't get treatment. And when people do get treatment, the majority of those people just take medication. And one of the problems with that is that if you just take medication, the likelihood that you'll ever be able to get off that medication is about zero without a talking therapeutic intervention, learning skills on how to control your symptoms and problems. But also, you're going to have a tendency to take more medicine than you would need to because you don't have any other skills or treatment.
Absolutely.
So people who get therapy in addition to medicine take less medicine. And so I think, there's nothing wrong with medicine. I think the other problem is the majority of people that take psychiatric medication get it from their general practitioner.
Yeah.
And, the example I always give of that, and people just laugh when I use this example, is I love general practitioners. I have some friends that are general practitioners. They're great. They are the heart and soul of the medical establishment. We desperately need them. But I would not have my general practitioner treat me for cancer.
Yeah.
I just wouldn't do that. Now, he or she might help me figure out that I have cancer and then get me to an oncologist. But why would I have them treat me for a mental health condition and not go to somebody who is trained to do that and the follow-up necessary and a specialist in that? We do it every day. And so that's the other kind of ugly stepchild of the mental health care system here, and that is while majority don't get treatment, what the data from the federal government suggests is that only a quarter of those who do get treatment actually receive the minimal necessary treatment for their illness because they're not getting treated the way that they should be.
Well, Matt, tell us about the Hope and Healing Institute. Tell us what you do there and the program you set up.
I got very interested many years ago, in how people access care, and it just seemed to me that it wasn't as complicated to get people to treatment as we seem to be making it. And, so looking at the data, where do people go first when they have these problems? We know they go to clergy. They're more likely to go to clergy, things like that. We know kids are accessing care more and more from health clinics at school. We know that workplaces have things like employee assistance programs and oftentimes have types of things there where people can talk to somebody. So there's a lot of opportunity. So, what we do at the Hope and Healing Center is we have a program called Gateway to Hope, and we train faith communities to be front doors to the mental health care system. So they learn what we call the 4 R's: how to recognize the mental health care system, how to make a referral in the mental health care system, how to relate to someone in distress, and then how to set up restorative programs. So we'll set up support groups there. We'll set up mental health coaches, which are kind of a paraprofessional that can provide some level of supportive care. But then we also do the same thing in schools, in public schools. We do the same thing in workplaces. And so really the goal is wherever you are, all you have to do is tell someone you're having a problem and you've entered the system. You can get some level of care right where you are, and then that organization can move you to professional care if needed. And so in the Houston area, we've trained over 800 congregations now, and over 1,000 public school teachers and administrators are working in a number of different businesses in the area. And so, really trying to develop networks of care where people can access it very easily. That's all kind of, there's an umbrella over that of a network of over 1,000 providers that we've vetted where they can refer into those, and they have all different levels of resource being necessary. So if you have no money, we have care for you. If you have money, we have care for you as well. And then at the Hope and Healing Center, we also run a clinic for people with serious mental illness. You go into a year-long program where you receive a psychotherapeutic intervention, a talking therapy, as well as medication. We have about 40 support groups a week for families and for recovery. We also do case management. So we have a year to work with the individual. It's all outpatient to help them get to a place where we then can transition them to a team in the community that can manage their illness. All of our treatments are free, so we even pay for their medicine while they're in the program. About 60% of the people that come there don't have the resources to pay for care. So for us, it's all about getting people to care and how can we come up with kind of unique and novel approaches to kind of getting them to care more quickly.
Wow, that's amazing. Give them the website.
HHCI, Hope and Healing Center and Institute, hhci.org. You can just go there. And we also have a training website that has all types of resources and training where you can equip your faith community or your school or your workplace. It's Gateway to Hope University. So you just go to gatewaytohopeuniversity.org and everything is there.
Well, I want to say, first of all, thank you to my guest today, Matthew Stanford. We can go on and on talking about this issue, but because I feel very passionate about the mental health crisis in America, and there's so many other issues that we didn't get to touch on today. So hopefully I can have you back and we can talk even
Absolutely.
more on this. Thank everyone for joining in today to this edition of Your Health, Your Wealth, and tune in for future episodes of this podcast. I want to thank again my guest, Matthew Stanford. Tune in to his podcast as well, Madness and Grace. And we look forward to talking with you more at our future episodes of Your Health, Your Wealth.